Yeah, that's another thing.
Let's do 2 next.
Hi, I'm Dr. Jill Vecchio, a radiologist specializing in breast imaging. I got tired of the rhetoric on both sides of the aisle talking about a series of YouTube videos. What we're going to talk about today is costs. How's it going to be paid for, and what is this really going to cost us as Americans? Will this law really decrease costs? They told us they would. Why is healthcare so expensive? Let's start with that. So right now we have essentially prepaid healthcare. Think about your auto insurance. When you buy auto insurance, it doesn't pay for your gas, car washes, new tires, or change oil. Right now we have healthcare that pays for all those things. You buy auto insurance to pay for catastrophic events. We have healthcare that pays for everything. So people can make a choice when they have back pain. They can have an x-ray. They could take a few days off, get a little exercise, do some stretching exercises, maybe a little physical therapy. They could maybe lose 20 pounds, or they could get an MRI. Right now, people are choosing to get an MRI. That's very expensive. Those are expensive choices that we're making as Americans. We're overutilizing our health care and not making efficient use of our health care dollars. That's a huge problem with our health care industry today. Another issue is technology. When companies started to offer the benefit of health care coverage for their employees in the 1960s, we had X-ray, barium swallows, upper GIs, and a little bit of nuclear medicine, bone scans. That's it. Now we have PET CT scans, CT, CAT scans, MRIs. We have all kinds. I'm a radiologist, so I give those examples. We have incredible technology, monoclonal therapy, immunoglobulin therapy, incredible pharmaceuticals. Our technology is amazing. It's doing wonderful things to help us live healthier and longer lives, but it's expensive. Another thing, a huge part of healthcare expenses today is government interference. Government regulation. Let's talk about the real costs. So if you ask a doctor, what is it going to cost me to have a CAT scan? They won't know. They won't know what to tell you. Because a CAT scan is going to cost differently if you're a Medicare patient, if you're on Medicaid, if you're a private insurance, and it depends on which private insurance you're on. Whether you have, what your deductibles are. Nobody can give you a single cost for a CAT scan because it's different for everybody. That's ridiculous. It doesn't allow competitiveness in pricing because nobody knows what they're paying. And nobody knows what the real costs are. So let's just keep that in mind, how ridiculous government regulation has made this. So now we have all of these CPT codes, and that's the coding thing is a whole other issue. We have to, as providers, we have to match up a little set of numbers for whatever the diagnosis is with another set of numbers for what the treatment is or what lab tests we're offering. And those little numbers have to add up with the third-party payers or Medicare. And if they all add up just right, then we get paid a certain amount, and who knows what amount that will be, because it changes for everybody, remember? So we have these little codes. So we have to hire people to keep track of all these little codes and make sure that they match up and make sure that all the little T's are crossed and the I's are dotted. If you ask the average physician, which I have, how much money they could save their patients, how much it could decrease healthcare costs if they didn't have to deal with unnecessary government regulations. There are necessary government regulations, believe me. But unnecessary government regulations, these coding entities, and the extra costs of billing and keeping track of all of this administrative garbage. They'd say, I could decrease my cost by about 40%, right off the top, 40%. And there are doctors right now doing that, and we'll talk about that in our last segment when we talk about healthcare reform ideas. Then there's the issue of medical legal liability. Frivolous lawsuits. Now, as a physician, and I think you'll be hard-pressed to find a physician that's going to say, you know what, I don't ever want a patient to be able to get paid if I do something wrong. That's ridiculous. If we make a mistake and somebody's injured by it, of course, there should be compensation. What we want to stop are frivolous lawsuits. lawsuits, even when we do everything right, and maybe the patient doesn't do something right, that's what we want to stop. We want to stop frivolous lawsuits that are costing you, as a taxpayer, as a premium payer for health insurance, as well as physicians and hospitals, unnecessary amounts of money. These things all make healthcare very expensive in this country. Now, let's give you a little bit of background here. So, individual states, they have a list of what they call mandates. You're going to hear the word mandate a lot during these talks. This kind of mandate says what healthcare coverages need to be in place in every single insurance policy that's sold in that state. So any insurance company that's going to sell a policy for health insurance in Colorado has to abide by their little list of mandates, and every state is different. The cost of healthcare premiums is directly related to that list of mandates, the required coverages. So New York and New Jersey have laundry lists of mandates, and it makes their healthcare premiums the highest in the country. So each state is different, and the premiums are reflected by the number of mandates. Also, there's a difference. Some people don't know this, so we're going to go over it. Medicare is typically health care for people over 65. Government-sponsored health care for people over 65. Medicaid is for people under 65 who are indigent or can't afford health care. Okay? Now, the federal government administrates Medicare for over 65. States administer Medicaid for the under 65 and indigent patients. Now, the federal government also helps states pay for the cost of those Medicaid patients. Now, as we knew from Part 1, 47% of the newly insured under the PPACA law will be put into these government programs, Medicare, Medicaid, and then there's a SHIP program that's a child health program. So 47% of the newly insured won't have private insurance, they'll have government insurance. It's going to be paid for on a state and federal level by we the taxpayers. Remember, all costs are passed on. This is crucial. So if states' costs increase, they pass it on to their businesses and taxpayers. If employers' costs are increased, they pass that on to some extent to their employees, or they may not hire, or they may cut back on their jobs, or they may take people from full-time to part-time work. Businesses are going to pass their costs on to customers and the higher prices for their goods and services. Remember, even if you don't pay federal income taxes, and 47% of Americans right now do not pay federal income tax. They may pay it, but then they get it reimbursed when tax time rolls around. So they have no federal income tax liability. Even those people are customers and employees, so they will have to bear the burden of some of these costs. Now, under the new law, this is what's required of insurance companies. No lifetime limits or annual limits on coverage. They can't rescind coverage. In other words, they can't take away your coverage or cut off your coverage. Those things are good. All these things sound really good. Dependent coverage up to 26 years old, whether you're married or unmarried. They have to accept pre-existing conditions, and they can't charge a higher premium for that. All of these things sound wonderful. They have to issue coverage to anybody who requests it at any time. That means that even if you're sick, if you don't have insurance, you get sick, you should be able to be issued health insurance. That's not insurance. That's not insurance. All of these things cost money. So let's look at the cost for these healthcare plans. This is from the Congressional Budget Office. The first set of numbers is from the Congressional Budget Office. And for the difference in bronze, silver, gold, platinum, the plans themselves are going to be exactly the same. The difference in the bronze to platinum depends on what percentage of the premium your employer will pay. So the gold plan, most employers right now are paying 85% of the insurance premiums for their employees. That would be like $19,200. This is a CBO estimate, and let's admit, we'll see how good they are at estimating things a little bit later. But $19,200 for a family of four. The first number on here is for an individual. That's a lot of money. That's what you or your employer will have to pay. Now, if you look at all health plans, and granted this is as of 2009, so pay attention, the dates are different. But all health plans were about $13,000 a year in 2009. Health savings accounts with high deductible plans, $8,000. That's a huge difference. Now, already in Massachusetts, we talked about Romney Care, also known as Commonwealth Care in Massachusetts. In 2010, their plans are very similar to the PPACA. Their coverages they have a lot of mandates, but their premiums for a family of 4 were $20,000. That was in 2010 already. Very expensive. Let's see how it's going in Massachusetts. So they have Commonwealth Care, also called Romney Care, very similar to Obamacare. Romney and his team helped develop the PPACA law, also known as Obamacare. So spending on Commonwealth Care in Massachusetts increased from $133 million in 2007 to $880 million in 2010. How is PPACA going to control costs? There are some differences between the PPACA law and the Commonwealth Care in Massachusetts. So first thing they're going to do, they're going to cut $575 billion out of Medicare. Now, of all of the healthcare reform plans being proposed across the country since 2009, this one, PPACA, Obamacare, our current national healthcare law, is the only one that